And good morning, good afternoon, everyone. Thank you for joining us today in our webinar on advancing quality in outpatient clinical practices, brought to you by the Mid-Atlantic CMS QIN-QIO Region 2. First thing I'd like to do is help us make the best of our time together and make sure we're answering all your questions. And we'd really love to have a lot of, if you have any questions, put it in the chat box feature. To send a chat message, open the chat panel on the side as indicated on the slide. Scroll all the way down and select everyone. So that we'll all see your question. And don't select all attendees, because that goes into the void somewhere. We want everyone selected. And then just simply type your message in the chat text box and press enter. And now we'd like to have you all just really enter your name in chat, your role, your organization, and what state you're in. My colleague Kayleese will be monitoring chat and answering questions and letting us know if you have any questions. I can't always see chat when we're speaking. So do the next slide. Okay, today's presenters. So it will be Joanne Vanterpool, at one of our senior quality improvement specialists, myself, Ann Merka. I'm also a quality senior director of healthcare quality improvement and a pharmacist. And we have a special guest, Dr. Maxine Orris, who will have a really great conversation with Joanne, and you'll learn more about what you can expect from working with us. So the Mid-Atlantic CMS QIN-QIO supports about 7.5 million Medicare beneficiaries to improve the healthcare quality in the region that includes Pennsylvania, West Virginia, Delaware, Maryland, and DC. The areas that we will be focusing on for the next 5 years, so we'll be around for a while. You can use us as you need us. Will include prevention and chronic disease management, patient safety work, behavioral health, and care coordination. And underneath all of this, pulling the work together, is quality management infrastructure, assistance that we can provide you, and that's like workforce resilience, etc. We'll kind of get into that a little bit more. We'll get into all of these pillars a little bit more in the webinar. And then we will be providing quality improvement, one-to-one technical assistance, affinity groups, and other ways that we can help you over the next few years. Only select hospitals, nursing homes, and outpatient clinical practices are invited to participate in this 5-year quality improvement effort, and that's why you were invited to this webinar. Engaged providers will receive an aligned approach with CMS priorities and your priorities, and also aligned with current quality reporting and payment programs. We're going to keep you up to date to everything that's new that's coming through from CMS. We'll provide you customized data dashboards and comprehensive measurement support, tailored assistance. So one-on-one assistance, that means that we meet you where you are. If you have a need, we will help you fulfill that need and work towards improvement in whatever area that you choose to focus on. Community connections, we also really want to help strengthen care coordination, have a shared language of understanding across hospitals, nursing homes, outpatient practices, behavioral health, all of these areas. We have the expertise to help you. And collaborative learning. So we share best practices, lessons learned, success stories, how to overcome barriers. We'll have lots of opportunities to work with you in that way. Also, we will send you a provider service agreement, and it will come through Adobe Sign via email, and it's just a click and an electronic signature to enroll in our program. The program is voluntary. You will work with us. We'll determine how we can best help you. This PSA lists out the benefits that you can receive from iPro. And once you're enrolled, you'll have full access to our assistance resources, education, tracking tools, etc. So you'll get the full complement of our help. So next, I want to pass it to Joanne, who will talk about the MIPS program. Joanne?
Hi everyone, and thank you, Anne, and thank you all for joining us today. We're really excited to talk to you about the 13th Statement of Work and the ways we can support your practice. I recognize that some of you have been participating in MIPS for many years, while we have others that may be newer to the program. So to make sure this session is helpful for everyone, we'll start with a brief overview of MIPS. And then from there, we'll walk through how working with the QIN-QIO as part of the Statement of Work can support your practice and really strengthen your approach to MIPS reporting as you prepare for the 2026 reporting year. So as you know, there are 4 MIPS performance categories that combines your overall score into a single score, which is from 0 to 100. That score really determines whether you'll receive a positive, neutral, or negative Medicare payment adjustment. And this is based on CMS's 75-point threshold. So let's go through all 4 categories. First, we have quality, and quality, which is 50% of your MIPS reporting, is the largest portion that is relevant to the practice. We then have promoted interoperability, which is 25% of your MIPS score, and that focuses on the use of the certified EHR technology. It includes e-prescribing, patient portal access, secure messaging, and health information exchange. We then have the third category, which is the improvement activity, and that is 15% of your score. And then practices earn credit for really implementing evidence-based and practice-level quality improvement initiatives. And the last category, which is cost, is 10%, and that is calculated from your Medicare claims. So practices do not submit data directly because CMS will analyze your claims for resource use and efficiency. Next slide. Next slide.
Oh, you didn't see it? It's not going?
No. Oh, there you go. Thank you. There we go.
Okay, good.
So now I'll break down how we can support you in each category. So under the quality category, our team supports providers in tracking and improving outcomes on measures such as hypertension control, diabetes management, infection prevention, falls reduction, and care transitions, many of which are directly tied to MIPS reporting requirements. Within the promote interoperability, we work with practices to optimize the use of a certified EHR technology. We look at patient engagement tools and secure data exchange, as all of which contributes to a higher PI score. In the area of the improvement activities, active participation in a QIN-QIO initiative, such as care coordination, patient safety, chronic condition management, behavioral health, workforce development, qualifies towards the MIPS improvement activity credit, giving providers measurable recognition for quality improvement work already underway. Finally, our emphasis on reducing avoidable hospitalization, emergency department utilization, adverse drug events directly support improvement in the cost category by enhancing efficiency and lowering resource use. So by engaging in the 13th scope of work, your organization is not only improving patient outcomes and advancing community health, but also positioning itself for stronger performance under MIPS, helping ensure compliance, maximizing all of your scoring potential, and achieving a more favorable Medicare payment adjustment. Next slide. So this slide is a crosswalk of the quality category in MIPS with the 13th scope of work and MIPS. It provides a clearer picture of how the priorities that are set forth by CMS under the QIO contract really align directly with the requirements already faced by practices. We've matched the MIPS categories, which are the quality and the improvement activities, to the corresponding aims and sub-aims within the statement of work. So the column on the left really shows what our clinical aims are, and the columns on the right really shows which MIPS measures are mapped in the statement of work. And these are all based on your quality measures as well as your improvement activity. Next slide. So this slide continues to show you how the MIPS and the 13th scope of work really align together. Like I said before, if you take a look at our clinical aims, you can see how we can map them to some of the quality aims that you're currently reporting on. Next slide. Before we wrap up the MIPS portion of this presentation, I would like to spend a few minutes reviewing an important reminder related to the 2025 performance year and the upcoming data submission deadline. For the 2025 performance year, all eligible clinicians and groups participating in MIPS must submit and finalize their performance data by March 31st, 2026 at 8 p.m. Eastern Time. This is the point at which the Quality Payment Program data submission window officially closed. It's important to emphasize that this deadline is firm. Any data that is not fully submitted and attested by that time will not be included in scoring for 2025 performance year. Incomplete submission or data that are in the saved but not submitted status will not count and may result in a 0 score for the performance category. The 2025 MIPS performance period runs from January 1st of 2025 through December 31st of 2025, and the submission window is already open. During this time, clinicians can submit through the QPP portal or through a qualified registry or the QCDR or through the EHR, but they have to submit. So we strongly encourage practices not to wait until the final days of the submission window. Submitting early allows time to review your scores, correct any errors, address validation issues, and ensures that your attestation is fully completed. Waiting until the last week can increase the risk of technical issues, missing data, or incomplete submissions that could negatively impact your final MIPS score. As a reminder, prior to submitting, practices should confirm their MIPS eligibility and participation status, whether reporting as an individual or group or as an APM. It's also important to verify that the correct performance year is selected in the QPP system and that all applicable categories and measures are accurately reflected. If you have questions about eligibility or you need help understanding your reporting options or would benefit from technical assistance related to quality measures or your improvement activity or submission readiness, we recommend addressing those questions well in advance of the March 31st deadline. Our goal is really to ensure that providers are informed, you're prepared, and you're confident going into submission so that the work you've done throughout 2025 is accurately captured and scored. So now I'm turning this over to Anne to go over the clinical quality strategies.
Thank you, Joanne. So we have 4 clinical areas that we'll be focusing on for outpatient clinical practices. The first one is prevention and chronic disease management, where we will help optimize adult immunization status, optimize annual wellness visits, and chronic condition management for hypertension, type 2 diabetes, and chronic kidney disease. We'll also be working regarding behavioral health and chronic pain management, improving access to and quality of behavioral health care with some focus areas of depression and suicide prevention, substance use disorder, screening and treatment, chronic pain management, and opioid management. We'll also be working on patient safety issues to reduce adverse drug events with a focus on opioids, anticoagulants, and diabetes medications, and improve risk assessments and plans of care for falls. And also, finally, care coordination to reduce hospital readmissions and emergency department visits and improve cross-setting communication. Our general approach to the clinical aims will include a tiered technical assistance, meaning that we'll give you the amount of technical assistance that you need, right? So if you need a weekly meeting and we're really helping you to interrogate your data and really fine tune your QI approach, we can help you. If you only need to meet with us quarterly, we can help you. If you think you have a good handle on things, we can check in with you to kind of provide a different perspective, but we're free. And so we're a resource that you can dip into at any time. And you may not know when that time would be. So we really encourage people to enroll with us. There is a time limit for enrolling. And it's fast approaching. I just wanted to put that out there. So we will have sub-aim specific action plans based on your needs. Again, using advanced data analytics, we'll be working with you on that. We'll also be providing aggregated comparative peer benchmarking. That means that we could help de-identify practices and compare apples to apples across all of the practices in our region. So you can see where your performance is versus another similar or other similar practices, and we can help identify what's similar or different about your practice. And then ongoing monitoring is provided. Again, like I said before, we can have affinity groups depending on what needs are, best practice webinars, best practice meetings. We always work with SMART goals that are specific, measurable, achievable, relevant, and time-bound. We provide training and education. And also we have multiple patient self-management initiatives. And we also really want to help with workflow, electronic health record interventions, optimization of billing. So you're doing the work, is it getting documented, and are you getting reimbursed for that work? There's a lot of opportunities there. And then we also have access to subject matter experts in-house and also national experts. So you could have, for example, I have a really great relationship. I'm a pharmacist. I've been working on anticoagulation and opioid safety for a long time, and diabetes medication safeties. I have access to those experts in the field that publish regularly and practice that we can tap into. I'm not going to go over everything on this slide, but when you get these slides, take a look. These are the kind of approaches that we're taking for all of our clinical areas. You might want to look at this a little bit more closely and see if there's something that you're actually working on right now, for your 2026 and beyond priorities that we can jump onto with you. So I'm not going to belabor this slide. I'm going to keep going, but I really want you to go back to slide 19 later. And then I mentioned this before, quality management systems, we're going to be working with you. That's emergency preparedness, workforce planning and resilience, supply chain management, including drug shortages, cybersecurity challenges, which is a challenge for everyone. And again, and also advancing healthcare quality through technology. That's really all of the health information technology, navigation around the EHR, integrating clinical decision support or order sets that make your life easier. Interoperability. So like I said, care coordination, you're all speaking the same language, those kind of things. So we really are offering a host of resources. And now I will end my presentation and we'll pass it off to a conversation with Dr. Maxine Orris and Joanne Vanterpool. Joanne and Dr. Orris.
Okay, thank you, Anne. So I want to take a moment.
Joanne, I'm having difficulty hearing you. I don't know if it's you or me.
Oh, can you hear me now?
A little better. Are the other panelists hearing Joanne okay, or is it me?
Yeah, it's a little muffled. Joanne,
Okay, hold on.
I'm speaking in now again.
Can you hear me now, everyone?
Better.
Yeah. Okay, great. So thank Anne. I do apologize for that. So the last part of this presentation, I really wanted to take a moment to really reflect on the work that we've done across earlier statements of work with providers we've supported in areas such as EHR integration, meaningful use, recognition, and also MIPS. So with that, I wanted to introduce Dr. Maxine Orris. Dr. Orris is an intern here in New York. Dr. Orris began working with iPro in 2009, and over the years, we've had the opportunity to support her practice through multiple statements of work and a variety of quality improvement initiatives. We've invited Dr. Orris to join us today to share her perspective and provide feedback on what it has been like working with iPro on these quality projects over time. So Dr. Orris, thank you so much for being with us today. And I just have a few questions to ask you about your experiencing participating in the QIN-QIOs. So first question, so how would you describe your overall experience working with the Mid-Atlantic QIN-QIO in the past, but also called iPro, through the last few statements of work that we've worked with you on?
I just want to say the presentation might sound so good that you don't believe it, but in serious, I was in a private practice, a single primary care provider in the middle of Brooklyn, and iPro came and was able to help me document the stuff that we do all the time, which is care for our patients, but we do not get reimbursed for it. And the reason why we don't get reimbursed for it is the documentation isn't exactly the way that CMS wants us to do it or other people want us to do it. And iPro was able, or specifically in my case, Joanne, was able to really train me and develop in my practice the ability to focus on my patients, focus on the improvement of the healthcare of my patients by allowing, by explaining and developing the electronic health records to really reflect what we were doing in the community.
Yes, I remember back in the day when, and I believe this was 2009, your practice was really using paper, and
Oh
you
yeah.
had just gotten eClinical Works, and we came in to help you integrate into the EHR and to do also follow different quality measures that CMS has asked us to work with you on so that you can follow your patients. So those are the things I remember back in the day where we were able to really help providers when it came to the EHR integration, so that they would get away from paper.
Yeah, I
So
mean, we in 2001, I started to participate in a program, one of the first programs in New York City to allow private practices to do EHRs. And so that it was an amazing um, situation where both the Department of Health and New York City um, and iPro were able to link together to really help private practices, which we all know, primary care, you know, we are the least paid, but the most needed now in our healthcare system.
Yes.
and what stood out most about iPro's approach compared to other quality initiative you participated in?
What Joanne was able to do was look at my practice and see what I needed and see what, for example, quality of health standards I had and how I could improve them and how I could take a small, I only had around 3,000 patients, but taking this and really being able to give the amount of care that is needed with the support. I mean, Joanne, as I remember, we spent at least 1 or 2 days together a week to be able to develop this and really, and she was able to tailor the kind of help I needed to the work. Now, if other people are really, if young people are in private practice and are great with medical technology, then she would be able to tailor that with the development of these quality challenges. Now, what we had in New York, which has changed now, were levels of stage 1, stage 2, stage 3, up to stage 5, to be able to benefit for reimbursement for the work that we were doing. And because of iPro, because of Joanne's help, we were able to have my practice at stage 5, which meant I got to really focus more on my patients and were able to be reimbursed for it.
Great. So, Dr. Orris, what advice would you give to providers considering participation in this new scope of work?
Take it. I mean, there could be there's no negative side effects. There's no sequelae that happens if one takes it. It really opens your eyes to little things that CMS would like to see documented. For example, I remember, just every year with diabetics, excuse me, to make sure that they have a microalbuminuria and that this is in the chart. Every 3 months that they have an A1C listed. So there really is no side effects for taking the aid from MyPro.
Okay, great. Is there anything you would have done differently during your engagement with iPro?
Probably develop it earlier,
Okay,
take it and register earlier. Because at one point we had to really do a real focus of trying to get all of the data in, as was said by Anne before. You really need to do the statistics and get them in way before time and way before the deadline, because if anything happens, it is a zero and you cannot repeat it.
great. How would you summarize your experience working with iPro in just 1 or 2 sentences?
I don't think there are 1 or 2 sentences. It was it was enjoyable. It was useful. It really changed the way that I saw not getting burnt out, but getting compensated for the work that I was put in. And I think very clearly my patients benefited.
Great. And would you recommend iPro and the QIN-QIO to other providers?
In a minute.
Great. So, Dr. Orrs, thank you so much. Like I said, it's been wonderful working with you in the past scopes of work and just seeing you how your practice has flourished. So, Anne, I'll send it back to you.
Great. Thank you so much, Dr. Orris, for that
My pleasure.
that wonderful, sharing your experiences in working with us. So I'm wondering if there's any questions, Kaylee's. Did anybody have any questions in chat?
No questions in chat at this time.
Okay.
So this is Joanne. Just very quickly, I just wanted to tell providers who are on the phone that we're here to help you with your MIPS attestation. If you have any questions, I know March 31st is the end of the attestation period. Please reach out to us because we are a free service and resources to providers to assist them when it comes to MIPS. January 1st started the new reporting period for 2026, and we will be providing you with information throughout the year once you join our program on to help you get ready for 2026 attestation. So please reach out to us because we're here to help you with that.
Great. Thank you so much. And you can see on screen our primary points of contact, how to get in touch with us. I'll be sharing the slides and the and the recording once I receive them. And also don't forget the PSA, the Provider Service Agreement, will be coming into your email. It will be an easy Adobe sign. all you have to do is get it to your whoever signs your agreements and get it back to us, and you're enrolled and you're ready to work with us at no risk, as Dr. Orr said. So it's at the end of the hour. I want to thank you all for being with us, and we look forward to working with you. Bye.
Hello, hello. Dr.
So
Ars, thank you so much.